Thank you, Andrea. Thank you to everyone. Ladies and gentlemen, I try to briefly introduce to in my presentation a quite recent story, what we did against the virus, against COVID-19. So briefly, I'll give you a few short about what was the role of the data in this terrible battle against the virus in Italy. In this chart, you can see a number of sources of information which are available in the Italian regional government. And basically, what we did is to collect all those information which are close into the silos that before Ulrich showed in a slide. And we use our platform, the Digital Enabler, which is a platform based on Fiverr. And thanks to the availability of this platform, we have been able in a very short time to combine, harmonize, and to give back to the government all the information in the right time to take decisions that are driven and to take action evidence-based. So basically, the story related to the virus is almost the same from China to Europe to the Americas, because the virus is always attacking the people in the same way. So the story was started end of February when we realized in Italy to have the first positive case. It was February 21st. And suddenly a regional government, the region close to Venice, which is called Regione Veneto, decided to collect all the information and to try to manage the emergency, to face the emergency based on the experience in China and some other countries in the Far East. And the first point was to collect information from the micro labs, providing all data related to the test. And then to combine the information with the data coming from the health patient records and all the information related to your doctor, your main pathologist, and some others. And we decided to combine the information with the source, with the registry, giving you the opportunity to know who are the people living with you together in the same apartment, in the same building, because they are exposed to the virus. And as well, the information related to the hospitals and to labor, because it's very important, mainly in this phase where our countries are reopening the country and the people will come back to the job. We need to protect them and we need to provide the right information in the right time. So basically, thanks to Fiverr, this is quite impressive chart because end of February, I just sketched on my iPad the idea of this system based on the digital enabler powered by Fiverr. And in a few days, we have been able to release the first dashboard for the medical doctor, which is now used by more than 5,000 doctors, receiving information about their patients, having a test, can be positive or negative, and they can plan their activities in knowing if someone is positive or not. And a few days later, we released the dashboard for the task force, the government task force, in order to take decision how to manage the emergency. And this is the first one. So stop slide. I'm going to spend a few minutes just to show you how the combination of data can really produce a huge value in something extremely concrete like this emergency. We are still living in the emergency, and probably it lasts for several months, and the virus will live together with us for a long time. So having the right information is something crucial. So basically, first, we started collecting information from the labs. And of course, we present information related to a set of data defined by the World Health Organization. So it's a common standard. But of course, the fields are completely different. region by region in Italy, country by country in Europe, nation by nation in another continent, by the virus is always the same. So we collect information in a large number of labs. We combine all the data. We are able to visualize the data, but mainly we are able to provide to the government the trends. What's happened today and what's happened in the last week. And we update all the data every hour. We started with 2 labs updating data twice a day, but now every hour, meaning, as we used to say, Ulrich in the Fiverr, right information at the right time. It's not important here to have the real time, but the right time is to have this kind of things updated. So moving from text to people, we are talking about a very sensible matters, and we have people infected, currently infected. But having these figures, we have people in the hospital, we know the people in intensive care department, and we have people in quarantine. Those information are so relevant because the most critical resource all over the world is the intensive beds in intensive, the beds in intensive care department. And in order to plan or to add new beds in intensive care, you need to flatten the curve or to reduce the spread of the virus. That's the main reason why we are living at home since last several weeks. And in this way, the government can plan. As you remember, in China, they built a new hospital in 10 days. And in Europe, we have been surprised by this kind of things, so strange. But now, in 2 months later, we are living the same tragedy, and we are setting up this kind of temporary hospitals in every city. You have seen Europe, or you have seen something in the United States and South America. So all those information are related to the city, and within the city for any single small village or small town. Why? Because every single mayor can receive by the task force information related to the number of people at home or the number infected, in order to provide them not just health services, I mean care, but if a family is close at home due to infection, they need to be provided by food or by some other things. And you can plan this kind of activity if and only if you know the process. Of course, we combine all those information to provide information to the central government, and then from every single government to the World Health Organization. But those information are important because in real time we are able to change. You can recognize here the curve, the famous curve. And the curve now, this is a sample, but I'm going to show you the real curve in the end of my presentation. This curve is important because we are able to provide parameter to the epidemiological model in order to use the observed data to change the parameter in the curve and to find the best way to fit the model. How the model is used for, mathematical model, in order to predict the peak, in order to predict how many people will be affected by the virus, in order to predict mainly, since the virus is an engineer, 10% of the people infected is in the hospital, and 10% of the people in the hospital is in intensive care. This is mathematics all over the world. So if you can predict how many people will be infected, you can predict how many beds you need in intensive care, and this way you can plan what you have to do in order to take care about everyone. So this is another great value about the number. But let me move to another point. Collecting the people related to the single person, we can see the status of the patient. We can combine all the information related, for example, to the medical doctor and some others. But what is most important is that I can show on the map for the task force the information related to a person, Mario, Mario is at home since February 22nd, is infected, and is supposed to be in quarantine, or is supposed to be in the hospital. And this is an important information, because we know he has some pathologies, and in the last recent year, he got few access to the hospital, but mainly in his family is living two persons, Federica and Marco, and I can know if Federica has some pathology as well. In this case, she could be a fragile subject, and we need to prioritize the access to the test in order to protect her, as well as the people living in the same apartment, in the same building. This is very super important, because in this way, the task force, the health authority, can plan for every single person the activity to be done in order to protect them. The last part, I'm going to the conclusion. Another fragile point of the system is the people working in the hospitals. As you can imagine, in all the country, we experience many people sick and attacked by the virus. But what is important for every hospital is to know how many skills are affected in terms of medical doctor, medical for kids, physician, nurses, and so far and so on. But what is important now is to know exactly when the people are virus free. Why? Because if I'm a citizen and I'm virus free, this is good for me, because I can come back to the job. But from people in healthcare is important, because, for example, let's put this way, I can, for example, look for the people able to be reintegrated into the job. And if I look for nurse, I can see I have only one nurse ready to be reintegrated. Where in the cluster of hospitals where the overload is very tricky. I've shown you now the real situation, but this is nothing on personal. This is the curve as it is 1 hour ago. As you can see, the curve is slowly going down, but it's not exactly. It is up and down in this way. So we actually reached the peak. After a few weeks, we reached the peak, but we are still in a plateau. In a few weeks, we move from 1,000 to 10,000, but now we are going up and down this way. And the last part, and I close my presentation using data, is the way we can use data looking at the cluster of infection in the country. And this is very, very impressive, because in this way, you can see the balloon. The balloon are the person, and I cannot click because I can receive all the information. But here you can see a small number, and the small number are people living together. So meaning the virus is changing the way to attack people, not in the street, but within the building, within the apartment where you are used to live. And this is very important, because we need to protect people in another way, and we can do that only and only if we know the right data in the right time. So thank you so much. I very appreciate to share with you this story, and the way technology and fireware can support quickly and promptly, with a prompted reaction, this tragedy, this global tragedy. Thank you so much to everyone.